Aloha everyone, my name is Leilani Sullivan. I'm a broker with Premier Benefit Consultants and we represent the most Medicare plans here in Hawaii. I'm proud to say that we're exclusive brokers to HMSA's Akamai Advantage plans, and I've been partnered up with HMSA for over 5 years. Our services are always free and I do not charge for them. I do have an office in Hilo on Kilauea Avenue, and we also have our office here in Honolulu. Just a little bit of background, I am the youngest of 7. My parents are from the Philippines, hardworking Filipino parents. I became a Medicare specialist when I met with seniors and they reminded me of my parents. So here I am. I love what I do. I love to service my clients, and I travel back and forth from Honolulu to Hilo every week. So I am here. Some people always say that I should get a house out here so I can live here. But anyway, we're going to talk about Medicare, basics of Medicare, and also introduce MAP, which is the Medicare Advocate Program, a partnership with KIAA and HMSA. So today's presentation, we're going to go over HMSA Medicare Basics, Akamai Advantage plans, the Standard and Standard Plus. Today's agenda, we're going to talk about the MAP, or Medicare Advocate Program, go through Medicare Basics, talking about Original Medicare and your options with Medicare, what to do, plan ahead for retirement, review the possible health options, and understand caregivers' need to knows. Here's my information. You could email me at this lani@pbchawaii.com, or you could call or text. The information is also going to be on the website. My services are free, as mentioned earlier, and I will continue and support you throughout the year or when your members are on the plan. This is our new office on Kilauea Avenue. It's in the Merrill Lynch building in the Kilauea Financial Plaza, which is across of MedQuest or Tyke's Laundromat on Kilauea Avenue. The Medicare Advocate Program, MAP, just think of it as a concierge program. So I would be the guide. So if you have any members who have questions regarding Medicare, questions like when I retire, what should I do? How do I apply for Medicare? You know, I have a current plan. How does that affect my, my Medicare eligibility? So this is what the program that KIA and HMSA are partnered up, and this is what we're going to provide for the members. What's Medicare? So Medicare is federal health insurance. If you're age 65 or older, or if you're under 65 and collecting disability for 2 years, you qualify for Medicare. And also if you have end-stage renal or ESRD, which is also known as Lou Gehrig's disease. There are several Medicare enrollment periods. The initial enrollment period is 7th month, so it's 3 months before you turn 65, the month of your birthday, and 3 months after you turn 65, which is your initial enrollment period. Special enrollment period is anytime you are still covered by an active group health. So if you're retiring and you want to enroll in Medicare, you have a special enrollment period to enroll in Medicare Part B. Or during an 8-month period that begins the month after your employment ends or your coverage ends, whichever happens first. The general enrollment period, so if you missed your initial enrollment period, the next time you can enroll without a special enrollment period is January to March 31st. And that's when you can enroll in Medicare, but it won't start until July 1st. So you have to watch out for that because you are susceptible for late enrollment penalties. If you're still working and you turn 65 or age 65, you still can enroll in Medicare Part A. You have no premiums. Enroll in Part B. If you work for a company that's smaller than less than 20 employees, or you can defer your Part B if you're working for a large employer or are covered by your spouse's plan. Now, Original Medicare has 2 parts. Part A is hospital. It's a $0 per month premium. If you're entitled to Part A, you don't pay anything monthly. It does cover your inpatient hospitalization, your skilled nursing facility, home health care, and hospice. You may have co-payment, co-insurance, or deductibles if you do use those services. And Medicare Part B is medical. The premiums are based on Medicare and also based on your income. So for this year, anyone who applies for Medicare Part B will be paying $148 per month. So it covers doctor services, lab services, x-rays, and other outpatient services. What's not covered by original Medicare is vision, dental, hearing aids, hearing exams, long-term care, and medication. So you would apply for additional benefits, such as supplemental or riders, to cover those benefits if you needed. So when you have original Medicare, you have two options. You can enroll in a Medicare supplement plan or Medigap. And with that, you would enroll in a Part D as in drug, a standalone drug plan. And option 2 would be Part C, which is also known as Medicare Advantage plan. So Part C includes Part A and B, plus prescription drug coverage and added benefits. So added benefits would include vision, sometimes dental is included. You have other benefits like gym membership. So option 1 would be considered something like an a la carte. You would have to enroll in your supplement and a prescription drug. So if you wanted vision, that would be a separate rider. Dental would be a separate rider. Option 2, with the Akamai Advantage plan, you have your drugs included and vision and other benefits. If you wanted to add a dental rider, you can also add it to that Akamai Advantage plan. So here are the premiums for the two plans in Hawaii County. We have the Akamai Advantage Standard at $40 per month and Akamai Advantage Standard Plus at $165 a month. Now, just because you're paying a higher premium does not mean that you receive more benefits. It's just a matter of the adjustments in co-payments and co-insurance for the benefits, and also the maximum out-of-pocket that you would get for each plan. Now, choosing a right plan for you. So sometimes I get asked, what's a good plan? What's the better plan? And, honestly, I wouldn't be able to tell because it's up to the individual. So someone who's fairly healthy, they hardly go to the doctor, the lower monthly premium would probably choose a standard plan. So it does, have a higher deductible, a higher cost, and higher out-of-pocket, maximum out-of-pocket. Someone who always goes to the doctor, they don't want to pay a deductible would probably go to the Standard Plus, a higher premium plan. So they don't want to pay a high co-payment, but they don't mind paying that higher monthly premium. So it really depends on the individual. And every time I meet with my clients, we also go through, the pros and cons of each plan for them. Why choose HMSA? Well, we start at $40 a month, which is a low premium compared to a lot of plans out there. It is a large PPO provider network, so you don't need a referral when you go to a specialist. As long as they accept HMSA, you can see that provider. You can also go outside of Hawaii, say if you want to go to Las Vegas, as long as you find a doctor who accepts HMSA, so it'd be within the Blue Cross Blue Shield network, you would be covered as if you're in Hawaii. It also includes gym membership. So if you have a favorite gym that you go to, hopefully it's part of the network of gyms that's included in Akamai Advantage. Or some people, they're not comfortable going to the gym, you can opt for the home fitness kit. So you can ask for maybe a band or weights that you can take home or sent to you. You also have that option of prescription drugs being mailed out. And because the distribution center is in Mapunapuna, so if you apply for the mail order, you'll get your prescription drugs within a week. You also have financial protection, which is also known as the maximum out-of-pocket. protection. So let's just say someone's on original Medicare. There's no maximum out of pocket. So every time they see a doctor or go to the hospital, they're paying 20% out of pocket with no financial protection. Whereas if they're on a Medicare Advantage plan, they either have a $3,400 maximum out of pocket or $6,700. So it really protects their pocketbook. There's no cost telehealth. Like we're doing right now, most doctors will have telehealth as their option. Vision exam and eyewear is also covered under Akamai Advantage. You have no copayment, annual wellness and screening, and you also have travel benefits. So if you travel outside of the US and you go to, say, Japan or Europe, any emergency or urgent care would be covered under the HMSA Akamai Advantage plan. HMSA individual dental plans, so you have several options with dental plans. Because most of the members are currently on a dental plan, when they apply for Medicare Advantage plan, they can sign up for a dental rider, and the waiting period would be waived because they're currently on a HMSA dental. And 90% of the dentists here are participating providers, so they would accept the plan. And again, there's varied monthly costs, so there's several dental plans that we can go over with the members when it comes to this option. Ready to retire, so we have a checklist. When they start to plan, we have to look at, okay, when do you want to retire? What plans you want to, enroll in? We review the health plan options with them. Sometimes your members might be covered under, VA or TRICARE. And we also want to plan ahead to enroll in Part B if they've deferred it. So we give it about a month or two to enroll in Part B with Social Security. COBRA, as you know, is a continuation of a large employer group health plan. So someone who's retiring and they get off their employer group coverage, they can sign up for COBRA. It is the same plan and benefits. It's a temporary health benefit until they are eligible for Medicare. And they would pay the total premiums plus the fees. They also have the option of Affordable Care Act. So this would be for people who are under 65 and not eligible for Medicare. If they do not have an employer group retirement plan or no longer is covered by their spouse or dependent. They also could qualify or eligible for tax subsidy if they enroll on healthcare.gov. And that tax subsidy would end after they are eligible for Medicare. As mentioned earlier, the other health options they may have is the Union Health and Welfare Trust Fund. And of course, they would talk to their union administrator to see how that's affected. Or they might have military health benefits such as TRICARE and VA or Veterans Affairs. We would go over the benefits to see, how that would be affected as well. So your options, employer group retirement plans, we would look at the start date, eligibility and costs, the spouse or dependent eligibility, the plan benefits, and qualifying for Medicare when they turn 65. And this is basically a caregiver need to know. So things to consider, we'd like to consult the plans on their coverage to verify the plan details. We would call the carrier before services to clarify their coverage. Understand their retirement facility charges, which is separate from the plan coverage. And then also complete any forms needed, like for HIPAA and CMS. And this would be done by Medicare, or I could also assist them when needed. Cool for Kupuna is a program that's sponsored by HMSA and Premier Benefit Consultants. So this is a show for seniors or for anyone, but it does offer seniors discounts. So the show will highlight some of the restaurants, local businesses, and organizations in each town. So they probably will highlight Hilo in August or September. I'm not too sure what the schedule is, but look out for Kufa Kupunas. It will start July 11th, every Sundays at 5 p.m. on Channel 2. And here again, this is my information. You can send me an email, call, or text, or you can also visit my website. This information will also be on the KIA website as well. Thank you, everyone. If you have any questions, feel free to comment in the, send your questions through the comments. And this is my information again, leilani@pbchawaii.com, or you could also go to my website at pbchawaii.com/Lani, or you can also visit the KIAA website.